Good morning, everyone, and thank you so much for joining us today. My name is Lizette. As we know, people from ages 20 to 29 years old are in the highest demographics of those coping with COVID-19, and cases continue to increase for those of 19 years of age. As if wearing a face covering, practicing physical and social distancing was already enough of adjustment to make for youth and young adults, many of us are beginning to grapple with the mental toll the global pandemic is taking on our lives. Today, Rachel
Talamantez
and Lorena Gonazales are with us to discuss how best young people can begin to deal with uncertainty about the future, feelings, anxiety, depression, and isolation, and mental health concerns. To let you know, prior to this segment, we removed our face coverings so everyone, including our American Sign Language interpreter, can clearly understand and communicate the information we will be sharing today. I just want to start off with you today, Rachel. Thank you for joining us today, as well as you, Lorena. So many of my peers and the youth are feeling emotions right now from anger and anxiety. What is your advice to them?
You know, all emotions are normal and okay. This is a very stressful time, so feelings of sadness, of anger, of anxiety, those are to be expected and perfectly normal. So whatever you're feeling is okay, and that's the first thing that I would encourage you to just think about and do, is just know that what you're feeling is okay. One moment you might feel perfectly fine, and then in another moment you might feel overwhelmed with emotions, not even sure of where they're coming from, and it can lead you to sometimes feeling a little bit out of control. Stress is, there's stress responses in the body that help us adapt and cope, and sometimes you might feel irritable or angry, and that's actually called the fight response. You might feel just kind of like arguing or feeling irritable or not in agreement with people. And that is an adaptive response. It helps us actually cope and manage our stress. Sometimes you might feel what's called the flight response. You might want to bury your head under the covers and just kind of pull back and move away from the world for a couple of hours or even a day. The other response is the freeze response, where sometimes you might feel stuck, you might feel like you can't bring an action plan to your mind to be able to help and support you with the stress that you're feeling. And again, all of these stress mechanisms, they're normal and they're adaptive, but what we want to do is make sure that they're not happening for too long of a period of time, and also that you have strategies to be able to support you with managing that stress. One important strategy is to acknowledge your feelings, and if you can, to be able to name them. There's an expression related to feelings called name it to tame it. And when you're able to actually say, I'm angry, or I'm anxious, or I'm worried, or I'm sad, it actually moves your brain from the emotional part of the brain to the thinking part of the brain, and actually serves as a calming mechanism. So one of the very first things you can do is just acknowledge, recognize, and actually name your feelings, and hopefully you can connect with somebody to be able to talk about your feelings as well.
Thank you so much for sharing that. That's very important. And Lorena, how can youth and young adults process stressful energy from emotions in a positive manner?
Well, try to be in a positive environment. I know with what's going on right now, it's very difficult. But if you're positive and try to be around people who bring that positive environment around you, it can be helpful. Again, we're making changes and it could be draining, but it takes time. It takes time and effort. So what I would encourage you to do is some of the strategies that we could practice, having awareness. Know about the negative feelings so that you can make changes that may not be helpful for you. Also, speaking up and talking to others may create a conversation that can bring up ideas about tools that you can use and strategies that you can implement to make a positive change in our world. Practice gratitude. Sometimes we forget what we have in that moment, whether it's simple as your pet, what you ate, a coffee, your friends. That brings joy to ourselves. Focusing on the present moment. Negative takes a toll on our body, and being aware of what is here and now helps you manage and identify some feelings that can be helpful. You know, we ruminate on the past and we talk about the future and think about it, and it creates some anxiety. So focusing on the present moment can relieve that anxiety. Doing something that makes you feel happy. Not feeling that it's a chore when you're doing it. I like gardening. A lot of young adults like to see movies or write or create poems. It could be something simple as that. Physical activities. We know that moving, incorporating some physical activities releases endorphins. And endorphins last throughout our day, and it creates that happiness in ourselves. And connecting with nature. Connecting with nature has shown that it can bring some happiness. But remember, social distancing and following public health recommendation.
Thank you. Yeah, definitely we have to make sure that we're in tuning with ourselves and taking that breather every day as well. I know sometimes many of the youth is they're working, so they don't really have time for themselves. So make sure to take that breather. Thank you. And also, some of my peers have admitted being ashamed to seek therapy. Could you share why a person should not be ashamed, especially the youth and young adults?
Sure. So research shows that mental health stigma creates a great barrier on why people seek or do not seek therapy. Also, our family of origin, our beliefs, our norms, shaped by our upbringings and our culture and religion, can focus on how we view therapy and how we view when we seek support. We don't want to feel that we're weak. Sometimes we talk to others and we see how they view mental health. Growing up as a Latina, you know, when we talked about seeking therapy, it was talked about that being crazy. You know, you're crazy if you seek therapy. And I'm not generalizing to all Latinas or all Latinos. Some Latinos are open. But in my family, this is the way it was viewed, is for crazy people. So why seek therapy? Well, we all want something different. We want some great things in our lives. So when we do that, we are able to create some strategies, some tools, interventions. Therapy gives us motivation. It empowers us, and we collaborate with others. So when you want to learn something about math, we go to teachers to collaborate and learn. When you want to create a physical endurance, you go to your coach. So why not go to a therapist to help you create those strategies and learn on how to make a better choice in your life? So stress came about for a lot of young people. They missed their proms. They missed going out to the last game, you know, the championship games. So going to therapy can help out in managing that stressful time that you have endured.
Thank you. Yeah, it's good to hear that from you, especially because I feel like right now therapy is such a taboo thing culturally as well. For myself as well, growing up, it was something you don't really talk about, or it's like, oh, maybe you're just like, it's just a phase. But sometimes we do need to take that step to go to therapy. So thank you so much for that. Hi, Rachel. We've been seeing stories of young people losing both parents. Also, community members have lost loved ones due to COVID-19 and are dealing with grief. Could you share thoughts about grief and possibly talk to those people who are experiencing grief?
Grief, I think, particularly for young people, can be very overwhelming and shocking. It's not something that we think about a lot with regards to death. And so when it comes to our life, if it's impacting us, meaning a loved one or a friend or a family member has died, it can be very, very shocking. People express grief differently, and sometimes you might feel anger, sometimes you might want to avoid the grief and get involved in whether it's school or work activities or other sorts of things to be able to just kind of distance yourself a little bit. Sometimes you might feel overwhelmed with emotion, but whatever you feel is normal. And connecting and talking with people about your grief and about your loss is really important. Connecting and sharing and talking about your experiences will actually be something that not only helps you process the grief, but it also is honoring the family member or the loved one that you've lost. Grief is actually also natural, and it serves a purpose. It helps us process what has happened, and again, it helps us remember and think about the people that we've lost. Sometimes when somebody dies, we also think about people that we've lost before. So maybe a grandmother or a friend. I recently had somebody that died 2 weeks ago, and she reminded me so much of my grandmother. And so my grandmother's memory, she died 10 years ago, my grandmother's memory is so present and so with me, and I feel kind of a sense of grief and loss that's been brought back up again. And so that can happen when somebody dies as well. A really important resource in Santa Clara County is the Center for Living with Dying. They have support groups, people that you can talk to. Their phone number is 408-243-0222. They're a wonderful organization that can help young people as well as children and adults and older adults as well. In time, difficult feelings will pass, and the memory of the people that you love will stay with you, and hopefully those memories will also bring comfort and a sense of warmth and connection.
Thank you. So COVID has affected all of us in different ways, but some younger people feel as if it's only them. Could you talk about the only me feeling?
Yeah. So when we're experiencing different kinds of things, being isolated from being able to go to school or work, or if somebody has died or our friends or a family have been impacted in different ways, it impacts us as well. And it can feel like nobody understands our experience or nobody has the same experience that we do. So it can sometimes feel like I have it worse than anybody else, or this is only happening to me, or like I said, nobody else understands my experience. And in some ways, to a certain extent, this is actually true. You're a unique individual, and your response is a unique and individualized response. But what can really help is to be able to connect with somebody who you trust, who can listen, and even if they're not able to share in the same experience that you've had, their ability to listen and hopefully acknowledge and validate and support your experience and feelings can often be very, very helpful. Sometimes I think particularly for young people, but really for all of us, it can also feel like maybe we're a little bit on display, like everybody's watching us. You might even feel a little self-conscious about people watching you to see what your response might be. And so that can be a little bit uncomfortable as well. And so again, reaching out and connecting to your peers, your friends, your family, a trusted teacher, a mentor, is really important in being able to get a sense of support for whatever it is that you're experiencing.
Thank you.
Thank you.
Lorena, what is the best advice you can give to youth and young adults to assist them with feeling better and having a better day?
I think focusing on yourself, that self-nurture. Sometimes you're so busy and we start wanting to take care of others, but it's important that we take care of ourselves first in order to help others. Connecting, finding ways to connect with other members. Sometimes, with this isolation, we're all apart. And so finding these new ways of connecting with your friends, with your family, with teachers, with coaches that you used to connect with, doing one thing at a time. Take it easy on yourself, as well as maintain active, creating routines on a daily basis. It helps us structure our day and make it less overwhelming. So those are the important things, some of the important things that I would recommend to youths?
Thank you. Yeah, definitely. I know that I believe 2 weeks ago I did a social distancing picnic with my friends, and we chose a very isolated park, and we had our own blankets and our own food. So even doing that sometimes, once in a while, not all the time, is very beneficial for us to keep ourselves grounded. Also, some of my peers and youth are feeling stressed to attend school online. What strategies might be helpful to managing online studies during the COVID-19 pandemic?
Well, we know that school will be resuming and it'll be online. Most of our schools, if not all, will be online teaching. And so this can impact the whole family as a whole. Having that tools, having the Wi-Fi's, it can create some emotions, some stressful emotions actually. And so, you know, for the parents, for the young kids, the adolescents, young adults, I would encourage you finding resources that can help you receive these technologies, these materials that you might need, reaching out to your teachers, to your administrators, to other peers, to your friends to see what can be helpful. And remember, you went through this already in this past school year. We started in March with online training, online schooling. So focus on what worked, what helped you during that stressful time, and what didn't work, and what can you do different. So those are the things that I might encourage people to do. But above all, when you're stressed, take a break. Take that break and listen to your body.
Thank you. And for my last question, Rachel, what resources are available to young people in the community to help manage stress, worry, sadness, or other feelings and experiences?
So we're very fortunate in Santa Clara County where we have a number of resources to support young people in our community. There'll be 3 resources that I'd like to share. The first is our Suicide and Crisis Hotline. And the phone number for the Suicide and Crisis Hotline is 1-855-278-4204. One of the wonderful things about the Suicide and Crisis Hotline is there's also a text number. So if you prefer to text rather than talking voice to voice, you can text the word RENEW, RENEW, to 741-741. If you'd like to speak with a mental health counselor, you can contact our behavioral health call center to be able to connect you with resources in our community. And the phone number is 1-800-704-0900. And you can also look at our behavioral health department website at www.sccbhsd.org. And finally, if you're struggling with alcohol or drug use, you can get support through our substance use services. And their number is 1-800-488-9919.
Thank you for those resources providing to the community. Also, some quick reminders. Facebook Live in Spanish is Monday and Wednesday at 11 a.m. and Facebook Live in Vietnamese will be Thursdays at 10 a.m. Thank you so much for your time today. Thanks for all you are doing for our community and keeping them safe. For the latest information on COVID-19, please visit the county's COVID-19 website at www.sccgov.org/coronavirus. Thank you for watching. Stay safe, and I hope you have a great day.